In a nutshell, we're protesting about Australia's continuing to spend more on so-called defence per capita than any country on earth except the United States, which, as we all know, is the biggest military spender. It's very difficult to understand why, because in reality, Australia has no natural strategic enemies. In the Defence White Paper of a couple of years back, a concerted attempt was underway to make an enemy out of China. And now we're wanting to have an impact on the drawing up of the next Defence White Paper, because we think making an enemy out of China would be against Australia's interests, and all in all, a very dangerous thing to do, and certainly a very wasteful thing to do. And we've come here to the office of the Health Minister, Tanya Plibersek, who's also the local Member of Parliament, to make the point that there are many better uses for Australia to put its public money to, notably in our own field, because we have a shortage of nurses in the country. There are strict limits on the extent of Medicare, which disadvantages people of limited means, such as extending it to dentistry, for example. All these perfectly helpful, legitimate uses for government spending, which in our view should assume a much higher priority than yet more on weapons that we don't need and will hopefully never use.